So mantle cell lymphoma, which progresses following initial chemoimmunotherapy, is typically treated with BTK inhibitors. This is at least my first choice as far as choice of agents for these patients. It has been shown with Ibrutinib at least that introduction of BTK inhibitors in earlier lines of therapy is associated with better durability of response. So as a second-line agent, this is my go-to. And currently we have two BTK inhibitors FDA approved in the United States. That would be Acalabrutinib and Zanubrutinib. I do think their safety and efficacy is very comparable in mantle cell lymphoma and relapsed refractory mantle cell lymphoma. So I don't necessarily prefer one over another. And now we also have approval for Pirtobrutinib for patients who have progressed on covalent BTK inhibitors. So, of course, the mechanisms of resistance in mantle cell lymphoma to BTK inhibitors is somewhat different from CLL. In CLL, it's dominated by mutations in BTK, such as BTK-C481S for covalent BTK inhibitors, and some novel mutations like L5AW for non-covalent BTK inhibitors. So in mantle cell lymphoma, the story is more complicated. Patients who progress on BTK inhibitors, some of them do develop mutations in BTK, but others have activation of alternative pathways like NF-κB signaling, phosphoinositide 3 kinase signaling, where they may not respond to BTK inhibitors, to non-covalent BTK inhibitors as well. Also, there are primary refractory patients, refractory to covalent BTK inhibitors in the first place, who never achieve a response. So the resistance mechanisms are much more diverse. So for these patients, CAR T cells can work well. So now we have brexu-cel and liso-cel as CAR T cell products for mantle cell lymphoma in relapse. And also emerging class of drugs for mantle cell lymphoma is bispecific antibodies, where Glofitamab so far has the most data, which is also very impressive in terms of response rate in BTK inhibitor refractory patients. However, patients with mantle cell lymphoma who are refractory to BTK inhibitors is still a very strong unmet medical need, and we need more data with novel drugs, novel agents there as well, such as BTK degraders.